Good morning, everyone. Thank you for joining us today. This is the Rock County Public Health Media Briefing for September 16th. This briefing is being streamed live on the Rock County Public Health Department's Facebook page. The recording will be available on our Facebook page, and it will also be uploaded to our YouTube page once the briefing ends. My name is Jessica Turner. I am the Communications Specialist for the Rock County Public Health Department. And joining me today, we have Nick Zupan, epidemiologist, Seth Longcar, Administrative Services Supervisor, and Katrina Harwood, Health Officer. So we start with some COVID-19 updates from our panelists, and then we will open it up to questions from the media. So I'm going to turn it over first to Nick, as usual, for our data updates.
Thanks, Jessica. So in terms of our total confirmed cases, right now we have 18,082 Rock County residents who have tested positive for COVID-19 over the course of the pandemic. If you've been following our data, you may have seen earlier in the week there were some very low numbers of daily increases in terms of confirmed cases. What has happened is there has been a lag in the statewide reporting of confirmed cases, and so our tally has been artificially lower than it should have been due to this technical glitch. So actually this morning we had over 100 new cases being added to our official total. That doesn't mean that as of yesterday, 100 people tested positive for COVID-19, but they're starting to sort out the data and update those official tallies. So if we look at our data over the last week, we're averaging about 30 new cases per day over the course of the last 7 days. When we look at our active case numbers, we have about 580 active cases in the community. So this is a little bit lower than it had been last week. Even regardless of the technical glitch, we're starting to see a little bit of a decrease in our active case numbers. There's been 196 deaths due to COVID-19. And right now there are 19 patients in the hospital getting care for COVID-19. And this number is slightly down from last week at the end of the week. In terms of our vaccination rates, we have 55% of our Rock County residents having gotten at least one dose of the COVID-19 vaccine, and 51.6% of our Rock County residents have completed that vaccine series. So that's all the data that I have to update this morning. I'll turn it back over to you, Jessica.
Thank you, Nick. We will now go to Seth, and Seth has some additional updates for us.
Thank you, Jessica. First, we'd like to provide a very brief back to school update. We've had a few inquiries about cases in schools. Our public health nurses are working closely with school staff to ensure that processes are in place to limit the spread, monitor cases, and contact individuals directly impacted. Similar to last year, we're doing our best to respect privacy while protecting public health. So we're working directly with the schools, and in the case of COVID-19 cases or exposure, working directly with those affected versus sharing publicly. We will continue to monitor and adapt this policy as we go forward, in particular if the rate of spread in the schools increases or there are other specific concerns brought to our attention. For now, this personalized approach is working well. Next, it's important we talk about the current status of COVID-19 in our country and hospitalizations in particular. Hospitalizations have been rising since August. To provide some perspective, last year, through the month of September, we averaged about 11 patients getting care in the hospital on a daily basis. This year, through the first half of September and to date, we are averaging 19 to 20 patients getting care in the hospital on a daily basis. This is almost double prior levels. The current numbers appear to have stabilized in September, but the figures are much higher than we would like, especially going into flu season. There's a potential for disease spread and other respiratory viruses posing additional. Each of these elements strain the healthcare system. It has a cascading compounding effect. When hospital resources are depleted or limited, it is troubling for anyone who needs care for any type of illness or condition. We have seen this happen elsewhere in the US, where people have been unable to get needed care for conditions besides COVID-19 because hospitals are overwhelmed. Currently, about 2/3 of our county's ICU beds are occupied. This number has been increasing since June. If this trend continues, we risk having a lack of available ICU beds. As Nick mentioned earlier, we may also have data that is artificially lower due to the state level reporting issues, which means we must be even more vigilant. We are following the numbers very closely and, in response to an increased number of cases, have reverted to crisis standards for contact tracing. As you can imagine, it's challenging to reach all close contacts given the high levels of activity, so we're asking confirmed cases to notify their own close contacts of a possible exposure to aid the effort. The more quickly we can do this, the better. Also, with the COVID-19 levels and exposure we are seeing, we want to once again stress how critical vaccination is in the fight to contain the spread. Based on data specific to Rock County, those who are unvaccinated are much more likely to get COVID-19, much more likely to require hospitalization for COVID-19 infection, and much more likely to die from COVID-19 as compared to those who are fully vaccinated. National studies show that vaccinated people are 8 times less likely to be infected and 25 times less likely to experience hospitalization or death. Vaccines remain effective in protecting most people from COVID-19 infection and its complications. It is critical we continue to encourage everyone who isn't yet vaccinated to do so. We can make a difference by being proactive. We want to avoid pushing our healthcare resources to the point where they simply do not have the resources left to care for everyone in need. It is not enough to see the numbers stabilize. We are still at a much higher level of COVID-19 infection and spread than before. The more people we vaccinate and the more everyone adheres to well-established COVID-19 safety precautions, the more likely we are to push those numbers down and ensure timely care and hospital beds are available for COVID and other patients when needed. We recommend wearing a mask in all public indoor settings, no matter your vaccination status. All unvaccinated, vaccinated, and individuals with underlying health conditions should wear a mask indoors in public settings. If not already vaccinated, please do so as soon as possible. Visit rockcountyshot.com to see the main options for vaccination that exist in our county. And for those getting their first shot, there is an added opportunity to receive a $100 Visa gift card from the state of Wisconsin COVID-19 Vaccine Reward Program if you secure your first dose from a provider in Wisconsin, Minnesota, or Michigan before September 19th. Please visit 100.wisconsin.gov for more information. Also, please continue to wash your hands and use proper sanitation, maintain physical distance, and minimize indoor time with people from outside your home, and test whenever you suspect you may have been exposed and/or are exhibiting symptoms. To learn more about testing options in our region, visit www.co.rock.wi.us/public health, click on the coronavirus link, and navigate to the testing section. Thank you. Together, we can bring the numbers down. Back to you, Jessica.
Thank you, Seth. So we will now open it up to questions from the media. Looks like today our only participant is Austin Montgomery from the Beloit Daily News. So thank you for joining us, Austin. We will give you the ability to mute and unmute yourself, and you can go ahead and ask any questions that you have.
Thanks, Jessica. Just a follow-up question today for Nick here on the, actually no, I think it was Seth who gave the hospitalization data. Could you just go over the figure you had said was almost double? I just want to confirm that I had those numbers correct. Thank you.
Yep, not a problem, Austin. So for hospitalizations right now, we are seeing about 19 to 20 patients getting care in the hospital on a daily basis. That's double prior levels. Around this time last year, we were averaging about 11 patients getting care in the hospital on a daily basis.
Thanks, guys. No more questions.
Thank you, Austin. So short question and answer session today. This will conclude our briefing for today. These media briefings take place every other Thursday at 11 a.m. They are live streamed on our Facebook page. And just a reminder, the recordings are available on our Facebook page and our YouTube channel once the briefing has concluded. So I want to thank everyone for watching and thank Austin again for participating. And if you're a member of the media and would like to participate in a future media briefing, you can send an email to media.publichealth@co.rock.wi.us, and we can provide you with the link and the information to participate. Be safe and be healthy, everyone. We'll see you in a couple weeks.